This dialogue is adapted from Chapter 6 of the book Artificial Intelligence in Physiotherapy and Allied Health, Leveraging Education. The content is for educational purposes only and does not replace clinical judgment.
Today, I want to talk about something fundamental for every healthcare professional: clinical reasoning. It's not just about remembering facts. It's about learning how to think like a clinician.
Yes, I've always felt that challenge. There's so much information, but applying it in real patient situations is the hard part.
Exactly. Clinical reasoning is like the mind's operating system in healthcare. It's the ongoing process of gathering patient clues, interpreting them, making decisions, taking action, and evaluating outcomes.
So it's not one step, it's a cycle that keeps repeating?
Yes. And developing this cycle is difficult for students. They often read theory in books but rarely get safe, guided practice to apply it.
Yes, especially when we don't always get enough supervised case exposure.
And that's where AI enters, not to replace educators, but to act as a learning co-pilot. It provides a safe environment where students can practice reasoning without risking patient safety.
So AI acts like a structured thinking partner?
Precisely. For example, if a student is confused by a complex case, they can ask AI to help outline a reasoning framework. The AI can show how an experienced clinician might approach the situation, step by step.
That would help them compare their reasoning with an expert model, right?
You are correct. They can immediately see which steps they missed or misunderstood. Then, the next step involves testing decisions in simulation.
Meaning the student can try different treatment approaches and see the possible outcomes?
Your point is correct. For example, if a student chooses an overly intensive exercise plan for a heart failure patient, the simulation may show fatigue and decline. But a moderate plan may show gradual improvement.
That kind of feedback loop isn't possible just from textbook.
Exactly, and it builds clinical adaptability. Students can even ask, what if this patient also has diabetes? Or, what if they lack home support? AI adjusts the scenario, just like real-world complexity.
That prepares them for real cases, which rarely follow textbook patterns.
Well said. But we must follow clear ethical rules. AI is a reasoning guide, not a tool to generate clinical notes or final decisions.
And definitely never to input real patient data.
Absolutely. Confidentiality is non-negotiable. Students must verify AI outputs and maintain human clinical judgment.
So the goal is not to replace the clinician, but to strengthen the clinician's thinking.
Exactly. AI is the co-pilot, but the clinician remains the pilot, responsible for judgment, empathy, and decision-making.
That means the real skill is learning how to ask the right questions and apply reasoning thoughtfully.
Yes, and that is the future of healthcare learning.